Hello everyone, let's try to solve this question together. So a cardiac murmur is noted followed by an echocardiogram in a preterm infant. The echocardiogram is shown here. The saturation in the left leg is 95%. The true statement about the finding is, so basic idea is that we have to interpret, so this is the apical view and this is the parasternal long axis view. So what you guys see there, based on that, the diagnosis has to be made. Okay, let's go further. So this is the bigger picture. So what you guys can see, you can see that both ventricles are almost equal size. So it means that there is some right ventricular dilatation, or you can say hypertrophy. So that's one thing. The second one, you can see here, the left atrial diameter is greater than the aorta. So the ratio has changed. So that's another thing. So what do you guys think is going on? Yes, most likely it's a preterm infant, and these findings suggest PDA. So what type of shunt PDA has? Left to right shunt. So let's walk through. So basically, this is the normal heart, and thanks for this reference. So basically, we are going to talk about QP shunt. So just try to understand that, blood coming from inferior vena cava and superior vena cava. So this is the blood that comes to the right atrium. It goes to the right ventricle. And from here it goes to the pulmonary artery, and you guys know already that once it's pumped here, it ultimately goes all the way there to the pulmonary vein, and then the cycle starts and then pumps back, and then things comes back. So anyway, not to further complicate, the basic idea is that whenever you have a left to right shunt, either a PDA or a ASD, the blood is coming back to the right side. So of course, if blood is coming back more, you will have more flow in the pulmonary artery. So just remember that, and this is just for the reference what happened in the shunt when the shunt is right to left. So now these are taken from internet. So basic idea is that this is the final derived equation to calculate QPS ratio. So this is the really the meat of the talk, that whenever you have a QPS ratio which is greater than 1, so always remember the P comes first. So if it's greater than 1, it's more pulmonary flow. And when more pulmonary flow means that is left to right shunt, and then the reverse. So again, to reiterate, if QP shunt is more than 1, the more blood is going through the pulmonary system, and this is left to right shunt, and the otherwise is the other thing. So let's go back to the question again. So what do you guys think is the right choice here? So let's walk one by one. So a cardiac murmur is noted, we know that. So echo, now we know it's a PDA. So PDA is a left to right shunt. So this one is out automatically because PDA here is left to right in premature babies. Of course, you have to know the dynamics from the echo to make sure that is left to right. And same token, the QPS ratio cannot, yes, it could be measured. We don't have to do all these, saturation measurements and all that thing. Echo can give you an estimate of QP ratio. So now we are left with two choices. So first one is the QP ratio of greater than 1. Now we know because this is a PDA, and we assume that with the PDA the shunt is happening and more blood flow is going to the pulmonary artery. So this is the right choice, and again this is the wrong choice because it's less than 1. So I hope this makes sense. Do review this. This is a very important concept, and I hope you all have understand something together today. So you guys have a wonderful day. Bye. Okay, here let's try to understand how PDA affects the flow on the pulmonary side and the aorta side. So we'll start with step 1. So as you guys can see here, there is a left to right shunt. So the pulmonary flow increases. Due to the increased blood flow, there is pulmonary edema. And of course, that will lead to increased blood flow in the left atrium and then increase left ventricle preload. So this is happening on the pulmonary side. So what is happening on the aorta side is because of the shunt there's a steal going on. So the descending aorta will get less blood flow. This decreased blood flow is going to the kidney and the rest of the body. So you will have a decreased blood pressure. You can have a decreased urine output, and because of decreased urine output, the serum creatinine will go up. So this is what is happening. And let's see the dynamics. So we'll start here. So the blood from the aorta goes to the PDA, goes to the lung, then again follow all that, and then the blood returns back to the left atrium, and then again it's pumped back. So the cycle just goes like this. So I hope this makes sense, and you guys have a wonderful day. Bye.